Hi, today we'll discuss about breast reconstruction. So breast reconstruction is the procedure of making a new breast. Usually it's done after the procedure of mastectomy. Mastectomy is required for certain patients of breast cancer in which the whole breast needs to be removed, either because the tumor is very large or because there are multiple tumors in the same breast and it is not really possible to conserve the breast. So mastectomy means complete removal of the breast. Obviously, as it indicates, it's a very deforming procedure for the lady, and losing a breast is not really a very simple thing. She ends up developing very low self-esteem and external appearances wise, she's very self-conscious. She cannot go out in the public, cannot wear dresses as she used to wear earlier, and overall depression and anxiety may set in after mastectomy. Hence, breast reconstruction as a method to provide a new breast to the ladies who undergo mastectomy has been proposed. And it is done not very commonly in India actually, because due to certain reasons, mostly economic reasons, ladies do not opt for it. However, it is always offered to all the patients who undergo mastectomy. So, what are the kinds of breast reconstruction? One is known as a primary reconstruction, in which the reconstruction is done at the same time as the mastectomy is done. And another is secondary reconstruction, in which the reconstruction is done at a later point of time. That means the mastectomy is done first and the reconstruction can be done after several months or maybe even years after the primary procedure. So what are the advantages of each of these types and which one should be done? The primary reconstruction is actually preferred usually by the surgeon also and by the patients also. However, the indication is that it has to be early breast cancer. We prefer that in cases of primary breast reconstruction. And the advantages, as I mentioned, are that it is a single stage procedure. So there is one surgery, there is one anesthesia, there is one recovery period, and the patient wakes up from her anesthesia with a new breast. And another advantage for the surgeon is that the local skin is more pliable and it's soft at the time of primary reconstruction, so the cosmetic results are better than they are with the secondary reconstruction. Then even cost-wise, it might be preferable to secondary reconstruction. And obviously, as I said, the feelings of anxiety and depression and everything are avoidable if you do the primary reconstruction. With secondary reconstruction, it is a delayed procedure and 2 sittings of everything, surgery, anesthesia, recovery are required. And the costs also double up with this. 2 admissions are required. And in some cases who have had radiation therapy prior, the skin becomes very tough and fibrotic, and it becomes a little difficult to do secondary reconstruction. So, what are the methods of breast reconstruction? There are 2 main ways in which we do. One is with the implants, silicone implants, and the other is with the local body flaps. So body tissue is taken from other parts of the body, it is shaped into a breast, and it is transferred to the post-mastectomy site and a new breast is constructed. So what is an implant-based reconstruction? First of all, this is how an implant looks like. Just to give you an example, this is a silicone textured implant. There are different sizes available. This is approved by FDA for use after mastectomy in the procedures of reconstruction. And according to the size of the breast that needs to be reconstructed, the implant can be chosen. And once the mastectomy is done, once the breast is removed, the implant can be placed there and covered with the local tissues or covered with some flaps. And the breast is matched in size and volume to the opposite breast, and a good result can be obtained with the use of implants. The advantages of putting implants for primary reconstruction or even secondary are that with primary especially, it's a single surgery, it's a short procedure, and doesn't take very long. After mastectomy, it takes maybe half an hour to 45 minutes more, and it is generally a good cosmetic procedure. However, one main disadvantage is that you can see the density of the implant does not really match the density of the breast. Hence, the implant does not develop ptosis. Ptosis means sagging of the breast. So the opposite breast usually will have some sagging, and this, even though it is equal in volume to the opposite breast, will never develop sagging. So one breast sort of remains a little higher than the opposite breast. In the undergarments, it is okay, it is same and equal volume, so there's no problem. But otherwise, one breast is likely to be a little higher than the other one. That is the major disadvantage of this. Another problem with this might be that in case radiation is required for this side after the chemotherapy or other treatments, then sometimes there is a risk of something known as capsular contracture. Capsular contracture is a tissue reaction actually that forms all around the implant in the body, and it forms a capsule. And the capsule actually slowly contracts. It leads to deformation of the implant, and as a result, it becomes painful, it becomes tight for the patient, and the whole cosmetic result is spoiled. In case this happens, the patient might require another surgery to release the capsular contracture, take out the implant, either change it or do some other corrective procedures. So that's about the implant. Implants are very safe, and there is a very minute risk of a new type of lymphoma that is related to the use of implants. Still, reports are coming in from the literature regarding this, but it's not really very widespread. And other risks like infection or bleeding, etc., can also happen in the surgical procedure, which are associated with every other procedure also. So nothing major or no major side effects associated with the implant. Implant does not lead to actually recurrence of the breast cancer again. That is one main problem or one main doubt that patients have, that if I put an implant, will my breast cancer come back? No. Implant does not really predispose to a recurrence of the breast cancer. Then coming to the second method of breast reconstruction, that is flaps. So these flaps are taken from other body parts. They could be taken from the lower abdomen, the lower part of the tummy, which is very loose, usually in women, loose and little thick tissue. Over there, flaps could also be taken from the buttock, from the thigh, or from the lower back. And these flaps are transposed onto the breast. They are transferred actually onto the breast. They are shaped like a breast, and they fill that gap that the mastectomy creates. Again, the shape and everything is matched to the opposite breast, and as close as possible, the cosmetic result is tried to be achieved. These flaps are again of two types. One could be pedicle flaps, one could be free flaps. Pedicle flaps means that all the tissue has its own blood supply. So, when they are transferred from the lower abdomen, they will have a blood supply and they will be shifted on the pedicle. However, in free flaps, they are cut. The blood supply is cut from the donor area, from the original area, and the blood supply is re-anastomosed in the recipient area. So blood vessel to blood vessel anastomosis is done. This is a microvascular procedure. This is done under the microscope, and the veins and the arteries are connected together. And that's the way the new flap gets the blood supply in the recipient area. So these flaps are of course very good. They provide a much better cosmetic result than the implants, and they are the patient's own body tissues, hence they are softer, they are more natural feeling, natural appearing, and they definitely are better cosmetically. Main disadvantage of doing the flaps is they are longer procedures as compared to implants. And a team of plastic surgeons and breast surgeons or surgical oncologists is required. Longer OT time is required. Post-operative recovery is longer. and the donor site, the original site from where the flap is taken, that also has stitches and scar. So there is a little bit of morbidity over there, and the healing is also healing takes a little bit more time basically. So all these advantages and disadvantages put together should be explained to the patients, and let the patient decide which procedure she would like to do. Everyone may not be suitable for every procedure. So depending upon the primary cancer, the treatment for that cancer, the mastectomy, the incisions that are going to be taken, the scars that are likely to be there, the skin pliability, the tissue around it, and many other factors have to be taken into consideration before planning the breast reconstruction for the patient. So, as I mentioned earlier, a woman undergoing mastectomy need not really be depressed and worried about having no breast. She can, at the same time of mastectomy, she can very well get a new breast reconstructed and lead a normal life again.